presented by Maya Strategy Group, a leading market research and strategy consulting firm, helping clients in the pet care and animal health industries navigate strategic challenges for almost 2 decades. Hello, everyone, and welcome to Pet Working. I'm Peter Kenseth, Vice President and Partner at Maya Strategy Group, and I'm here today with Guillermo Coelho of Maven.pet. Maven is a wearable, and we've done a lot of work on and talked a lot about wearables, both in terms of pet trackers and health monitors. We've done episodes with Tractive and Invoxia. I was really taken with Maven at Western Vet this year. I ran into Guillermo's colleague, Joanna, and we posted a brief clip on LinkedIn following Western Vet, but I wanted to bring Guillermo onto the show to talk a little bit more about the solution and the wearables market for pets in general. So Guillermo, welcome to Pet Working. Thanks so much for taking the time to join us.
Of course. Thank you, Peter. I mean, it's always a pleasure to talk about Maven and pets and at the end of the day, what we are doing to help pets live longer. Yeah.
Yeah, I mean, I think that's the goal. And I say it's one of the reasons it's really easy to get excited and impassioned about working in this space is making the world a better place for pets, helping to extend people's time with their pets. It's very fulfilling. Everybody out there loves 100%. Their dog or cat just as much as you do. The famous quote is, "Everybody thinks they have the best dog in the world, and not one of them is wrong," right?
Exactly.
So, yeah, so I guess to start, let's tell people a little bit about what Maven is. And I was really, grabbed by it from the perspective of you're tracking health data. And I've used the Invoxia collar with Peony for almost a year now, and I found it to be very helpful, in tracking her heart rate, her respiratory rate, her heart signature. And I think for a lot of people, when they first, see the idea of a wearable for a pet, they think, why do I need that dog? Why do I need that for my cat? But when you think about it, it gives you insight into that baseline data that you wouldn't otherwise have, right? And we think about it, we wear smartwatches, smart rings, maybe not everybody, but it's somewhat comforting to be able to to look and, make sure that your heart rate is in the right place and just have that general check-in that you otherwise would only get if you were going to the physician's office. And probably even more pronounced from a vet perspective, and this I think is the really cool twist with Maven, is a lot of pets don't get into the vet as often as they should. There's statistics out there. A large percentage don't even make it into the vet for an annual checkup. And we've talked about, we had an episode a ways back with Heska. Now they're part of Antec, but with Dr. Ben Hantler and about preventative diagnostics. And a big theme of that was, in so many cases, if pets were getting into the vet more regularly, a lot of these conditions that become very problematic to manage when left untreated could be very easily addressed up.
You
had a very 100%. Similar experience in founding the company. So maybe tell us a little bit about how you came to found it, how you came up with the concept for Maven, and a little bit more about the product itself.
Yeah, so you did an amazing job explaining what's wrong today in the industry, and that's exactly what we are tackling with Maven. So, I mean, talking about a little bit of my personal experience. So I've had mainly dogs my entire life. So I grew up with pets. I actually don't know what life is without pets. And one of our dogs, Tommy, is no longer with us, but he was a lab mix with husky. So a big breed, slightly obese, like unfortunately a lot of dogs are. And Tommy was getting older. Okay, Tommy was super active throughout his life, but one day Tommy was barking at us because he was no longer able to stand up by himself. Okay, so it was this like visual impacts and Tommy barking was the trigger for us to took Tommy to the vet. Okay, and obviously at this stage, Tommy was already dealing with a late stage arthritis. There was really nothing we could do, right? As you were saying, treating arthritis on a late stage, it's hard compared to if you act early. And I'm not a vet, I'm an engineer. And I was pretty sure there were signals early on, right? I was pretty sure Tommy was getting lethargic 3 or 4 months before. I was pretty sure Tommy was getting discomfort through nights or being intolerant to exercise. Okay, signals were there. We were just too busy, or we don't have trained eyes like vets do to spot these nuances. Okay, but with technology we can. And so that's exactly what do at Maven. The wearable is a piece of it, but there's others. We build technology, and then we partner with clinical teams so that precisely to what you were saying, Peter, we can help them diagnose early and treat smarter, right? Because it's entirely different to treat I don't know, arthritis condition or canine cognitive dysfunction or separation anxiety or any chronic condition in a late stage compared to an early stage, right? So we do that on the human health. It's obvious, okay, but I don't think anyone is doing it to the extent Maven is on the pets health market, okay, and that's exactly what we aim to do.
Yeah, and I think you're absolutely right. You know, people are busy. People have limited sources of income. You know, limited discretionary funds, and I think too often, we there is this practice of putting your pet's health into that discretionary of like can I can't afford to take my pet to the vet, or I don't want to take my pet to the vet because I'm not sure I'm going to be able to afford the treatment. And I continue to come back to this because it's one of the main reasons I started the podcast, and we have we've had a lot of conversations around pet insurance on this podcast, but that's certainly one element of the problem is making sure that there is a safety net to be able to pay for the care. But the other side of it is knowing when you need to get your pet into the vet. And like you said, not everybody has trained eyes, and dogs and cats are genetically predisposed to hide pain. They don't try to advertise it. So that it does tend to be these symptoms, maybe a change in heart rate, maybe a change in respiratory rate. Maybe talk us through, some of the, of the biomarkers that Maven is able to track. And then we could talk a little bit about, how you're linking into, the various PIM systems that are out on the market to help get pets to the vet more often.
Yeah. So and just a note there, people don't realize this, but actually, if you act early on your pet's problem, you will end up saving money, right? Because instead of doing like a bunch of different exams, because the clinical team needs to sort out what's wrong with your pet, if it's an early stage, they can diagnose much faster, okay? And that will save you time and save you money. And that's something that people a lot of times don't realize, but what we see with Maven is pets that are on Maven, because we can flag problems early on, okay? I mean, yeah, you will need to do one exam or two, you will need to start medication, but compared to if you acted in a late stage, okay, you are actually saving money, right? So I think that's an important note to tell people. Telling you a little bit more about Maven. At the end of the day, Maven is a tech company. So we develop technology and technology solutions for the preventive market in the health space, animal health space, okay? So we partner with clinics and we develop what we call an artificial intelligence vet, okay, which is this system that monitors the pet 24/7 through a sensor, okay? So this is the sensor right here. It goes into the pet's collar, monitors different sorts of behavior throughout the day, 24/7. Okay, if the pet is walking, if the pet is sleeping, deep sleeping, excited, if the pet is shaking their head, drinking water. We have biomarkers such as the resting respiratory rate. Okay, and we monitor all of that 24/7. Then there's obviously a mobile app. Okay, where the pet owner can log any symptom, where our system will trigger specific questions for the pet owner if we want their input. Okay, and then the third piece is the access to the PIMS. Okay, so all the information that the vet has on their patients, okay, our system knows as well, and we can label pets according to their diagnosis, according to their treatment plans. We can change our approach based on the pet profile. Okay, so I will look at the veterinary medicine. It's not a one size fits all. Okay, it's a pet specific approach. What is this? What is the clinical profile for these pets? What is the baseline for these pets? Again, and then we look for changes that might be relevant. Okay, clinically speaking, and then you should visit the vet. Okay, so just giving a couple of use cases. We do a lot of cardiac patient because of the resting respiratory rates. People are already going home with guidelines on how to count for breaths per minute when their pet is resting. We do that automatically. Okay, we do that automatically. We will flag it if something is wrong so that you can tackle problems early on. Okay, we do a lot of mobility problems, post-surgery. Senior pets start to dealing with some sort of osteoarthritis problems to monitor that they are recovering well, or if they had a bad day, things like that. We do a lot of anxiety as well, because we can monitor for whether the pet is okay when you're not around, if the pet is getting overly excited when you leave your house, some behavior problems such as canine cognitive dysfunction, for example. We can see how the pet is sleeping, if there's a change on their patterns, or if they are sleeping well. So those are just some of the of our most common use cases where really having our technology can change the outcome of care.
Right. And again, having that kind of baseline data too, where you could see, okay, this is what's no, as the longer you wear it, and have that record, you can see, oh, well, you know what, looking at that individualized approach, my pet's, resting respiratory rate is 16 NPM. And, this past week it's spiked to 25. That's probably a trigger that's gonna,
Yep.
log in your algorithm to ping the pet parent on the app to say, hey, get your pet to the vet. You know what I mean? Are you monitoring heart rate as well, or just respiratory rate?
So, I mean, it's a very contextual thing, the respiratory rate. So we only do it at resting. Okay, so we first validate that the pet is completely still for the past couple of minutes. Okay, and then we measure the respiratory rate. Okay, and then if there's an odd measure, we remeasure again to make sure it's an actual change on the baseline of the respiratory rate, and nothing like a bad dream, for example. Things like that happen. Okay, and so we do have proprietary technology for the algorithm that we use for respiratory rates. Okay, and that by itself, it's a great proxy for heart problems, for respiratory problems. Okay, so it's definitely on our roadmap to tackle heart rate. Okay, but doing it in a way that's clinically valid, it's hard today. Okay, and one thing that's unique about Maven, we have a big team of vets working with us. We have a clinical advisory board. We are close to academia. We have studies going on with OVC, University of Florida, North Carolina, to make sure that when we build something, okay, it's actual. There's some clinical validation to what we do, and it's a good proxy, and the gold standard technology that we should be using. Okay, so respiratory rate today is already a great proxy for heart problems and respiratory problems, but it's definitely on our roadmap to tackle heart rate as we go. Okay, so it depends on priorities. A lot of our clients ask for seizure detection, so that's something that we are start working now. Water intake is really crucial for chronic patients, for example, patients with diabetes. So at the end of the day, I believe technology can do a lot in terms of pet health. We just need to understand what to tackle first, because there's so many things to be done. Yeah.
Right. You can look at scratching, and if that changes from the baseline, having that be an indication of a
Yep.
dermatological condition. Yeah, for sure. And Gary, you mentioned, it just the sensor, it just attaches to an existing collar. Or is there do you does a dog have to wear a different collar that is specially designed for the Maven sensor?
Yeah, very soon we will have a solution that's attachable to any collar. So I know people have their special collars. They want to change different collars, and so we will come up very soon with a solution there where you can just attach our sensor to any collar.
That's great.
Yeah.
That's great. Now, I know one of the things that we've talked about before, and is that you're tracking a host of biometrics, and that's all getting fed back into the vet's office. But the view that the pet parent has within the app is more limited, correct?
Yes, correct.
Can you talk a little bit about the rationale there?
Yeah, of course. So again, Maven is the first truly medical grade system in terms of remote health monitoring. Okay. And so everything that we did was based on our clients' feedback, our clinical team's feedback, our clinical advisory board feedback. Okay. And so again, the experience from the pet owner is clearly different than the experience from the clinician. Okay, so a lot of our clients asked us and told us that they don't want the pet owner to freak out because their pet hasn't been sleeping well for a couple of nights. Okay, that might be normal, or that might not be the case to go to the vet. Okay, so we know there's a lot of there's a huge shortage of veterinarians in the industry. Okay, and so vets, they don't want pet owners to just go to their clinic for something that they don't need to go. Okay, or being calling the clinic for something that's normal. And so based on that feedback, we built the experience for the pet owner in a way that they feel connected about their pet. There's still a daily report, there's still a night report. There's a timeline of what their pet is doing. They can look for respiratory rate. They can look for how often their pet is shaking their head or drinking water. Okay, they feel connected to their pet. They are more in control of their pet well-being. Okay, but the flagging system, it's something intended for the clinicians. Okay, because there's a whole set of context, there's a whole set of expertise that the pet owner doesn't have, and they don't need to. Okay, that's not their job, and so that's why when our system flags a problem, okay, you will get a call from your vet, okay, explaining what's wrong, explaining what Maven system flagged, asking a couple of questions if needed, okay, and then booking an appointment if needed. Okay, because what we've learned is you already have a vet you trust your pet's well-being with, right? You trust your vet, you have a relationship with them, and so if something is wrong with your pet, you want your vet to be calling you, okay, instead of you freaking out and putting your pet on your truck and drive to the closest vet. Okay, maybe there's not a need for that kind of panicking and anxiety. Okay, if something is wrong, your vet will be in touch with you. Okay, and I think that's like, we can do this in pets, we cannot do this in humans, but I would love if my GP could look at my Apple Watch data or my Whoop data or whatever it is, and let me know, like, hey, you've been on a lot of stress, you are not sleeping well, maybe it's time for a health checkup or something like that, right? Instead of the other way around, me looking at my sleep trends and my respiratory rate and wonder whether there's something wrong with me or not, right? If I have the peace of mind of knowing that my vet is keeping an eye on my pet 24/7, okay, that burden of being constant worried about my pet goes away. And that's what we feel pet owners want, and that's the feedback that we have for people that are using Maven on their pets.
Sure. And to be clear, it's not that the vet is there, looking through your pet's biometric data, ad nauseum, right? Your system has is AI based and has triggers that, will flag certain algorithms. And then you also have a clinical team that is reviewing those flags um,
Yep.
from a remote location.
Yeah, yeah. So this is a constant work in progress, right? So this AI vet that we've built, I mean, we've been developing this for the last 3 years, and every new feature, every new use case, we look at what we are doing and we optimize, right? So for the vets, and I spend a lot of time in a hospital setting with vets, with nurses, with technicians, with the front desk. I've learned everything about them, and I know everyone is super busy, packed schedules, overwhelming. But if there's one thing in common, back to what you said early on, is they all wish the pet was brought sooner to the vet. Okay, they all wish the pet owner had realized sooner that something was wrong. Okay, and so what we do with Maven is we unlock that for clinical teams. Okay, in a way that there's no extra work for them, because if something is wrong, our system will flag it. No need to go and look into data, looking into chart. Our system will flag it. Okay, and then that patient as a potential health issue. Okay, and then we can automatically book the appointments. Okay, so for the clinical team is business as usual. They know if something is wrong with one of their patients, okay, they will come into their front door. Okay, and so I think that's really important for the clinical teams, because I know everyone is super overwhelmed. They don't have time to look at another tool. They don't have time to go through charts. Okay, you need to do that. That's our expertise. That's what our team, that's the algorithm that we build on, personally, to do that for you. Okay, everything you need
How
to
does this
know is.
translate?
So
How
sorry.
does this translate in the workload for your team? I'm just thinking from a scalability perspective, right? Like, I know you guys are a young company. You've just launched. I don't know how many users or clinics you have onboarded, right? But I'm guessing, as this, scales and sees increasing levels of adoption, you're going to have to bring on more and more people to kind of review the flags that your algorithm is generating, right?
Yeah.
And to book appointments, or do you have it set up so that it can all be done on an automated basis without increasing the workload for the clinic?
Yeah, so a lot of things are automatic as of today. Okay, now every time we develop a new feature, like shaking or watching take or the seizures. Okay, now the moment we have dogs with seizures, we are building the alerts, we are building the AI. Then we need to have our clinical team on top of it and making sure it makes sense, and we bring external people to help us validate it. But once it's set up and fully working, everything is automatically. So we don't have a
Really?
team reviewing every single alert, because we already know if you have an allergic pet with a past history of flare-ups and it's allergy season, and suddenly your pet is shaking their head twice as much as before, and waking up in the middle of the night as twice as much as before, we already know that's problematic and most likely dealing with the allergy flare-up. So it's an automatic flag happens, and we get in touch with the pet owner to visit the vet. Okay, so we build things in a way that it's scalable, and we can have thousands of pets wearing Maven. We don't need to have a huge team behind it. So yeah, I think that's the magic of it. We can be preventive in our pets' well-being without a lot of work. Yeah.
Now you just mentioned that it's a kind of act. What I thought I just heard you say is it a two-way interface between the PIMS and Maven? So is your AI able to pull past health data from that pet's medical record, and in like the example you just gave, where the pet has a past history of allergy? Is that a flag retroactively if, like, my vet's clinic comes on board and they see Peony's never had a history of allergies, but they see, oh, she had, you know, uh, she did have melanoma, right? And that, there might be certain biomarkers that you have that are associated with cancer. Is there that ability, as you're integrating with the PIMS, to go back and kind of assimilate previous medical records into the algorithm, into the flags that your system is generating?
So again, our integration with, I'm not sure if I understood your question, but our integration with PIMS today is we have access to all the clinical profile of each patient, okay? And now we are working in the next stage where if something is wrong and our system flags a problem and we will book an appointment, we will add what we are calling pre-appointment insights, okay? So that was actually something that our clients asks us, okay? If I have a pet, if you book an appointment for a patient of mine, and if you have information of what's wrong, I want to know that, okay, before the appointment,
Sure.
okay? So we are looking into ways to also write on their PIMS that kind of information that's valuable for the clinical team to be faster to diagnose and to treat.
And so you're able to write those preclinical notes. Are you all? Is there like the periodic biometric tracking? Is that getting recorded in the PIMS on a regular basis to say, oh, okay, we have the baseline respiratory rate, we have, this is their baseline heart rate, as recorded by Maven. And to re-clarify my earlier question, I guess I was asking, is your algorithm able to read each pet's medical history that is in the PIMS? So
yeah,
from the moment that you integrate with the PIMS, you have a view back into that pet's medical record, and you're using that to inform your algorithm and to make your flags and your diagnoses.
exactly. Yeah, so we have access to all the previous history of each patient. So we know everything that happens since you went to that clinic, since that vet started treating your pet, okay? And answering your first question, as of today, we cannot have our data being pushed to the PIMS, okay? So I don't think PIMS are, as of today, prepared for that kind of integration, okay? Now there's a tool, which is the vet portal, where each vet has a login and they can log in. They will see all their patients on Maven. There's a page for all of them. They can see how their pet is sleeping, the activity, the respiratory rate, the journal, medical notes, everything is there. So what we see happening is our system flags a problem. We book an appointment, okay? The pet owner goes into the vet, and while the vet is trying to understand what's wrong, they open the vet portal and they have like hard data to base their assumptions on, to base their diagnosis on. They can discuss with the pet owner, see your dog is not sleeping as well as before, your dog is shaking their head much more often, see there's a spike on the respiratory rate, maybe we should iterate on the medication, those kind of things, okay? So the moment the pet is there at their office, they want to have the data to base their diagnosis or their treatment.
Right. And it's super helpful for them to have that because, so often, and we talked about this on the previous episode we did with Invoxia, which, again, is providing that, it's not automatically pushing the info to the vet, but it is, you are able to send the owner, I'm able to kind of download a report and send it. The common factor here, though, that I think a lot of people miss is that you can bring your pet to the vet, but the vet isn't getting a full view of your pet when they're in an exam room. Your pet's nervous. If it's a cat, it's probably been forced into a carrier to go there. I know when I bring Peony to the vet, she knows,
Different.
not
Yeah.
like something bad happens to her every time she goes there, but
Yeah.
she knows I get shots here sometimes. Um,
Yeah.
she gets a little worked up the minute we're closed in that 8x8 room and there's no windows, and you're not going to get an accurate heart rate. You're not going to get an accurate respiratory rate. You're not going to necessarily be able to,
Yeah.
observe them for a long enough period of time to see if their behavior, increased scratching or whatever is abnormal. So
Yeah.
I think it's hugely important for vets to have this view into the pet outside the clinic because that's where they're demonstrating the symptoms. That is their, unlike, human, I think in humans they call it white coat syndrome, but I think for most of us, we can present and we can articulate how we're feeling when we're at the doctor's office. Our pets can't.
Exactly.
And so you need, and we can give our anecdotal observations, but for them to be able to have that hard data is hugely important. Um,
Yeah.
Getting back
If
to the PIMS, are there any PIMS that you don't? I know you said Covetrus is managing the integrations with the PIMS for you. Are there any PIMS that you are not integrated with at this time, or?
Yeah, I mean, our first partnership was with vet data, okay, which is Covetrus. So we cover 80 to 85% of the PIMS. We are now working with IDX to have access to EasyVet. A lot of our clients are using EasyVet, and then it's as we move forward and we see where the demand is coming from, we will keep working on different integrations, okay? But with our partnership with vet data and IDX, we would be covering close to 85, 90% of the market, which is already very good. Yeah.
Yeah, that's great. I mean, obviously,
And
IDEX and Covetrus
yeah,
are huge leaders in that space. So,
yeah. And Peter, circling back to something that you said early on, I mean, vets are doing a lot with very little. If we look at vets are diagnosed, vets are treating based on 10 minutes per year they have with a patient. Okay. There's no reason as of today to restrict the action of a vet on those 10 minutes. Because with Maven, we can have the other 365 days that are left. Okay. And so this is not me saying, this is what vets say. 80% of their job is based on communication. Okay. Asking the right questions, reading the right answers from the pet owner. So it's the pet owner describing how their pet is doing, okay? And we know human intuition is far from reality, okay? How we think my pet spends or what I think my pet does when I'm not at home, it's not the reality, okay? So a lot of times, and then we see this with Maven. So there's a flag, we get in touch with the pet owner explaining what's wrong, and we receive like, oh, I thought everything was okay. Oh, now that you mention it, my partner mentioned that Finny hasn't been sleeping well, but I thought she was doing okay. Now, I mean, data doesn't lie, okay? And so our goal is really to help vets to be through Maven to be even better at their job, okay? To give them tools that at the end of the day will empower them to diagnose and treat easier, but more important, faster, okay? Because if we zoom out, vets are base their diagnosis and treatment on the 10 minutes they see a pet, okay? And those are superheroes, and they can still do amazing things. But I think that with Maven, we can do so much better. Okay, so we have plenty of use cases where just by acting early can really change the outcome of care.
yeah, and your discussion of time and the visibility into 365 days a year kind of hit at a more technical question for me. What is the battery life on Maven? How often do you have to recharge it as a user? And because obviously there will be gaps when you
Yep.
have to recharge.
Yep. So you have to charge it twice a month, okay, which is entirely okay. So on average, we cover 23 hours per day per our patient. Okay, so that's a lot of data, as you can manage. We are very granular on the sensor level. And so obviously we try to optimize to as close to 24 as possible. But yeah, people have to charge it. Sometimes people forget about it on their desk. Obviously, there's email, there's push notifications, all of that. But at the end of the day, people know that if we are missing data, we might be missing the opportunity to flag a problem early on, Okay, and if if someone is on Maven, it's because they want to tackle problems early on. They want to be preventive. So I think we've done a great job to that extent. I think twice a month is pretty okay, and we are already on a high level of the data per patient, so that we can flag and learn those abnormalities on each pet's behavior. Yeah.
No, that makes entirely reasonable. I think 2 weeks of battery life is great. In terms of getting access to Maven, right now you're only distributing through vet clinics, correct?
Yeah, I mean, as I said, we partner with vets. So even if your vet is not using Maven today, but you want this on your pets, you can go to our website, maven.pet, as easy as that, and you can refer your vet. Okay, and then we will get in touch with your vet, and you would have access for free to Maven because you referred your vet. And if you are a vet, you can just go to our website, book a demo. We will tell you everything about our solution. We can start with specific use cases. If you are a specialty, so we do a lot of cardiology, we do a lot of surgeries. You even if you're not a general practice, you can leverage our preventive solution.
If your vet already has Maven and you aren't able to take advantage of the free product for the referral, what does a collar cost?
So the collar costs $70. Okay, and then there's a monthly subscription for this around-the-clock health prevention monitoring, which is $19.99 a month.
Okay. Okay.
And
And
yeah,
you're not doing GPS on the collar, right?
so not GPS. This is a medical device, so there's no location.
But if you have the clip on to a collar, theoretically, you could also clip on a tracker if you wanted to be,
Yeah,
if you
yeah,
wanted.
exactly. Yeah. When I walk on Central Park, a lot of people already have an AirTag or any other device for the location efforts. You can just clip Maven sensor to the collar that you already have, and you know your pet is protected if something concerning starts to appear.
As you know, down the road, obviously right now, given the functionality that you're looking to address, in providing vets with more information and the tracking, and you need the vets to be onboarded to get it to the consumer. As you see more vets on board and embrace Maven, do you one of the things that I was struck by earlier, you have all this data, and we think about, where the pet insurance industry is right now. We've talked, on this program about it. It's ripe for innovation. It is ripe for new product development, for disruption, change. One of the big ways to do that from an actuarial perspective is data. And certainly, if a pet insurance company on an individual level has access to your pet's health data, and they can see that they're active, that they're walked regularly, that there aren't any flags, that's probably a case where you could develop some kind of model to give a discounted insurance rate.
Yeah.
And because they're going to be going in and seeing the vet when they need to, you're not going to end up with these cases that are catastrophic. It would seem to me that potentially down the road, looking at a distribution partnership with a pet insurance company or pet insurance companies could make a lot of sense for you guys. I don't know if that's on your roadmap at all.
Yeah, it is, and we are close to a lot of the insurance companies, because there's different ways I see insurance companies working with Maven. One of them is definitely leveraging our data to have tailored price points, okay, based on your pet, based on how you take care of your pet. But more important than that, I really think insurance, by partnering with Maven, we would be saving money to insurers. Okay, because as you said, instead of waiting until it's too late and it's a catastrophic amount of exams and the huge invoice to be paid, if we act early, things are simpler. And so we actually had recently the first case where an insurance paid for our product. Okay, because yeah, it's a cardiac patient. And so the vet prescribed our solution to this cardiac patient because it's beneficial. It's needed for their health. The pet owners are already going with the guidelines on how to count for breaths per minute. So why not having this tool that does it automatically and flags the vet if something is wrong? You will end up saving money. You as a pet owner, you as insurance. So I do think there's a lot of synergies as we scale, as we go, for Maven to partner with pet insurance companies, either as a distribution partner, either as by covering the cost of our solution, either by helping them tailor their prices based on data. We do that on the human side. So I think pets will just follow as the market matures. Yeah.
Yeah, no, I think it's great. It's you know, we've definitely, I think in the last 20 years, come a long way in terms of how we view pets as a society.
Oh yeah.
And I think, you look at our parents' generation and, pets slept outside, they weren't welcome in the
Yep.
house, they were viewed as very disposable. And there's still that, ideology that exists in some people. I was reading an article in the Atlantic the other day that was talking about the high cost of veterinary care and, noting that maybe at a certain level we don't need to be investing copious amounts of money into the medical treatment of our dogs. I look at it though, it's like we ask so much from our dogs and they're so selfless in what they give us in terms of emotional support and companionship. I think it's pretty selfish to take and then not give back in
Not
terms of
give.
doing everything we can to keep them healthy. Um,
Yep.
I people call their dogs, members of their family, and I think, it's true. I mean, um, it's not anything that if you're not a dog owner, you can relate to. But unlike you, I did not grow up with pets, and Peony's the only dog I've ever had, but I could not imagine life without her.
Yeah.
And and I think, like I said, everybody I know who has a dog feels the same way. And um, from my perspective, whether it's investing in pet insurance or investing in a preventative diagnostic, a wearable, you know, the things you can do to give your pet a better chance at living a happy, healthy, and fulfilling life, they're worth it. And like you
100%.
said, if you catch things early and you're proactive about it, you will end up saving money in the long run and you're going to have a happier and healthier pet. So,
Yeah, 100%. And yeah, people, when we see this a lot with Maven, when they realize something is wrong, but you act early on it, and it was so simple at the end of the day, they don't want to go back. They don't want to go back to a world where they have no idea what's going on. Okay, they have to be the ones understanding these nuances, or if something is wrong with the pets. Like early on Maven, we were doing like market research and interviews with pet owners. All of us pet owners, we are constantly worrying about our pets. Is something wrong? Are they happy? Are they in pain? Are they stressed? Do they like their food? Am I exercising enough? Do they want to go outside when it's raining or snowing or whatever it is? So we have no idea what's going on. If I can tell a pet owner, like, just use this wearable, just use the mobile app, just be like, charge it every other week, and you know that if something is wrong, your vet will know about it. You and your vet will be able to tackle it from day one. Okay, this peace of mind doesn't exist. I mean, now it does with Maven, but before it was not. It was something that people were constantly worried. Now that I have a dog now. She has, I mean, twice or 3 times a year ear infections. Okay, I was constantly worried about her, looking and trying to understand if she was shaking her head more often, if she was like scratching her ears or sleeping badly or things like that. Okay, now I have the peace of mind that knowing if something of anything like that is happening, Maven will flag it. And I know my vet will call me, and I know I'll take her to the vet, and I'll know I'll just need to clean the ears for a couple of weeks and everything will be fine. Whilst before, I would realize too late when she was constantly shaking her head, so it was impossible for me to miss it. Okay, and I need to do antibiotics, I need to do a lot of cleaning. It was much more difficult to treat. Okay, once it took me 3 months to treat for an ear infection. Okay, nowadays it's like 2 weeks, just because it's early. Okay, you just need to clean it and make sure it doesn't get to a worse condition, and it's sorted out. Okay, so that's I with Tommy, I was not able to do anything because Maven didn't exist. But now with Moppy, I have the peace of mind of knowing if something is wrong with Moppy, it will get flagged early. I'll take care of it, and life is easy. And she's happy, and that's all we want as pet owners.
That is well said. Well said. No, Guillermo, this has been great. I think you have a really cool product here. I'm excited to see, as it grows, and hopefully we'll have a chance to check back in with you down the road, to make sure that things are going well, and to hear about what I hope are many successes. We'll for the listeners out there, as Guillermo said, you can go on maven.pet if you're interested. Refer your veterinary clinic. It's just a doorbell, Peony. It's okay. And
Yeah,
you can
and you can look. Yeah, you can also look on the website if your vet is already using Maven. So you can search for your vet. If your vet is already using it, you can just buy it, and automatically it will appear on your vet's portal, and your vet is keeping an eye on your pet.
Simple
Simple
and effective.
and effective.
Yeah. Well, I look forward to seeing the rollout. Hopefully, we'll see you at Western Vet again next year with a much bigger booth and a much bigger presence.
Yes.
And excited to see potential partnerships with insurance companies or wellness plans.
So,
I think there's a host of opportunity out there for you. So,
yeah.
Guillermo Coelho, Maven.pet, everyone. This is Peter Kenseth with Pet Working. Really appreciate y'all taking the time to listen today, and we'll catch y'all again soon. Take care.
Thank you. Thank you, Peter.